show up. And my opinion is that it would slow the group's work down if we had to wait for people's response, or if they came in after we'd done months worth of work and had an opposing opinion. So I'm not really much in favor of reaching out to people who haven't shown up so far, as long as they know they're invited. But again, I think that's been a problem across all commissions, and it's usually, in my opinion, better to go on without the non-participating folks, because it's almost impossible to catch up on the amount of work that's been done so far.
And you give up the right to show up at the last minute with a vetoes.
Yeah, I mean, those are interesting points. Yeah. So, yeah.
If I don't have a problem with that statement at all. I'm kind of, a lot of us have a lot of stuff on our plates, and we kind of sometimes forget about some of these things. And when you get in the habit of not going, you get in the habit of not going. And I mean, to send a friendly reminder that's probably a bad idea, and to make sure they get it back on people's screens. When you mentioned the thing about the elderly, like if people aren't coming because they feel like they're not being represented, we need to hear that. And that was an important statement you made. So I don't think it hurts to reach out and say, this is important. Do you want to be part of this or not? And if you don't want to be, well, then maybe we need to look at that too.
We do that for our patients, where rule of thumb is if we haven't seen you in 3 years, which is a Medicare standard, put you into an inactive state. When you do represent, you're considered a brand new patient, because after 3 years, for all intent and purposes, a lot has changed. We're going to start all over again. So what you do, you're in an active state. You're always welcome back with the patient. It's a mulligan Monday, and it's a do-over because you haven't seen you in 3 years.
I think the one argument I would, or just point I would make, is we have, I think of Kathy Bowler, I think of Maddie. There's 3 or 4 folks that have been pretty new here that have actually come up to speed on their own pretty quickly. So I think I don't think that's completely a deal breaker, but I do think it would have to be an expectation that you really want to do this, and that you're work with me or whoever to really come up to speed on what we're trying to do. But that's for the council to decide. Dave Nagel's in the lobby.
No.
Oh, sorry.
Justin has his hand.
That's it. You're right. Yeah.
Is that my fault?
Yeah. Just do your volume and speaker, Dave.
I just muted.
There you go. Perfect. You're fine. Okay, Justin. Sorry.
No, you're good. I do want to step off in 2 minutes
Sure.
briefly, but I mean, I guess I would agree that a nudge is pretty important. We do it with our boards. I mean, I think from the operational aspects of the board, how many years did we have issues with quorums and whatnot, and if people are kind of just a slack load, because they have too much going on, and it's drawing down the productiveness of the board, then maybe they need a nudge. Maybe it's looking at the composition of the board. I'd rather have less members that participate and are moving this forward than not having quorums, not being able to make progress because the 15 or 20 of us and I miss meetings, but the 15 or 20 of us are making progress, but we can't move it forward because we don't get the quorum. And I know we've taken steps to address that, but we do it on a regular basis. Put out, this is participation. If they're representing a group, we push it to the group. This is what your representation, or this is the amount of time your representative has showed up, and let them kind of address it. And so that's just my 2 cents.
Yeah. I mean, I think we've been trying to do that. I think that's one of the reasons that we have some new folks, but I think one of the things, and I don't know who brought it out earlier, but like, I'll get you a list of kind of at least where the representation is, not the people. I don't care about that, but like, these are the folks that are not represented, and then we can have you all make a decision on whether you want to really, if we find that somebody that really should be there and their people are not served. Go ahead, Woody.
I was just going to chime in and say, I think the part of the agenda that's coming up where there's going to be conversation about work groups and sort of what is the next focus of this council, that might, like, there are certainly people who may not have been as interested in attending meetings, looking at data or developing plans, but they may be very interested in like getting involved in work groups. So maybe when we have like a clear invite of like, this is what the council's focusing on, that would be good to share too. Because there have been like sort of phases, I think, for what the council's focused on, and not everybody loves each of those phases as much as, everyone else. So.
Good point. Yeah, that's a good point. Anybody else? I want to make sure we give especially our online folks, a chance to chime in.
Oh, we've got someone in the room.
Okay.
Kim.
Okay. Kim, of course.
Agree completely with what Whitney just said, because the first few years of this was sort of laborious about data and things that, make my head ache. But I think if we do go into committees and work groups where we're trying to apply the health improvement plan to actual populations in the state, I think that there might be more fruition there that's tangible. And Polly, I completely would hate to see no one representing our senior population, since that's most of our state. And I think the needs there, for at least what the needs that I see with the developmentally disabled population, certainly are very applicable to the senior population. And so if we feel like we're moving toward a goal, hopefully that will create more interest, but that's yet to be seen.
I think, is there somebody else with a hand up? Because I have something to say.
I think you're good. Yeah.
Yeah, and it's one of the particular areas that I represent people. I'm usually the only voice typically in the groups that I'm at. And I'll be honest, if I wasn't there saying what I was saying, it would never even get addressed. So the fact that you're even here bringing that up is really important. One of the big problems I have with the legislative process in general is it's this you snooze, you lose type process. And if you're not part of the discussion, you won't be part of the solution. So what you said today was really important, and that was good. So I think it is important to reach out to make sure that all those voices are here. And like when I create a committee, I think that knows is we just find out who needs to be here, who's not.
And I think the other thing about this is the elephant in the room is like trying to get 35 people on the same schedule is virtually impossible. So there may be some people that they're trying to, but that whatever time we come up with is just not there.
With that said, everybody can appoint somebody to represent.
Right, I got you. Yeah.
So if they make it part of their group.
But it's frustrating. I know, even Ollie and I have talked about, he's got a very important situation for himself at noon all the time, and we're always crossing over on that. So it's just so hard. It's a very hard thing to try to get 35 folks on the same page. And I think, to your point, Dave, I hope that I hope we make a place that's safe enough so Polly and others can say exactly what they need to say. I hope that we're doing that. So I think what we probably should do next is I can get you all, as a part of the notes from this meeting, exactly what areas we're kind of missing. And then I will make sure I certainly reach out to those, and then we can make, you as a council can make a bigger decision based on some of that work. If that works for you, you can give me a thumbs up on that. So since I'm home and I can't actually hear you say anything. The second part of that, just to keep us on time, was I think we can go ahead. I'm sorry, Ellie.
I just want to say thank you for raising that. But as I said, between 8 and 1 on a Friday, I'm good. But at 1 o'clock is when
right.
I have, and the other things, I don't know what you have on your list, but if we don't have any immigrant-related organization representing here, I think it will be great to have one of their voices here as well.
Yeah, I think we can certainly, that's my job behind the scenes, to try to work on that. And if people have connections to those organizations, they can, when they see them, they can always reach out. It's a lot easier to reach out to somebody, at least somebody at an organization a little bit. So if there's somebody we're missing, Dave, am I admitting you again? Are you running out of the room and coming back?
I don't know what happened.
I mean, I'm a 50-something-year-old man, and I leave the room a lot. But it seems like you are leaving the room a lot. So yeah, I'll
Maybe
do
with-
that for folks, and I think we can kind of carry that on. The work group participation, I think we'll just move right in because we're just a little bit over our time. So I think we can just start the work group decision, and I think discussion. I think we can go from there. I am
Let's do
going
it.
to try to move on. Yeah, it would be great if I could do that now that I mentioned doing that. So the idea of this is came from the leadership work group. I want to thank Tori for really bringing out some pretty strong points that I don't think any of us had really thought about, because you may remember I sent out for last month some discussion on work groups. Well, we've pretty much changed that, and I think it was, and Tori, feel free to speak out. I don't want to put words in your mouth, but really moving more towards the domain specific work groups, because there's really no way we can move the ship forward if we have kind of a work group situation that doesn't address those. I don't think, based on, I mean, did I say that accurately, Tori, do you think?
You did.
Okay. So, I mean, I and it's funny because I was against it. I was like, oh, people don't really want to do that. And, you know, we did this last year, but really by the time we ended up finishing our conversation, I felt like this was really a very positive way to go. And Tori's brilliant, has been brilliant since I've known her and long before, I'm sure. So I think what we're after here, okay, Dee, I know you're a little bit late, is that we hope each of you will join at least one domain and work group. And really, from what I looked at the last year, you all had not only done that, but sometimes 2 or even 3. So I think that that's where we're headed, is one work group for each of these areas. And the idea was, from the leadership work group, was to do a 3-month pilot. So you work on these things for a period of 3 months, and then we really, you know, do a lot. We'll have a little more discussion at the end of this about how exactly we can define success. Because the one thing we know from the summer with all the interviews was that you have to have a purpose, and you have to really know, you know, kind of what a successful work group situation is kind of like. So this just gives us a little reminder of what these each one is. So here's your access to opportunity group. So I think about, again, Maddie with education, Phil is big in economic stability. We've got a few different food security people. Again, Maddie does both education and food security. Housing, we have a few folks with housing. Yes, I'm sorry, Ed, go ahead.
Just go back a slide for a moment.
Sure, hold on one sec.
I wanted to provide when I think about the ship at the state level, it then gets me into a region. So we have a community needs assessment we do across roughly 26 plus towns in the country that entails health consortium, a variety of people. And then looking at how to align that. And then we as an organization have a strategic plan on it. So the more it's in a line, and I did take opportunity to do that, but I just want to provide one concrete example of when I think about this is, if I'm going to take an action at Andalusia, that's part of our strategic plan, can I pick something that cuts across more than one of those domains? So when I think about our food as medicine portable teaching experience, it increases access to the opportunity to learn how to cook foods from 30 minutes prep to plate. In fewer than 30 minutes, we're able to keep the price per meal under $4 a meal compared to a Big Mac at $8. Since we come together and we're launching a Cook Together, it then provides a sense of community. And Polly's point, 40% of our patients over the age of 64 experience social isolation across many miles, winters like we have today, and loneliness. So it addresses that. And because we cook with low sodium and low carb, if you have diabetes or hypertension, now we're touching on health status outcomes. And then that social connectedness. So that's how I think through going down through how many of these areas that can I put one thing out in the wild. Now those results, when we get those, I need to find a way for them to come back through the community health needs assessment and back to the state health assessment in some sort of. So I just want to provide that as an example of what can be possible, and that's at a hyper-local level, reflecting on the state health improvement plan, We all live in a hyper-local community. You may already be doing some really cool things that nobody knows. So that's that community-based asset inventory of what's going on in your community today. It actually does this, and how do we reinforce that, put a spotlight on it. Because if people are doing great work, it's sad if we don't, A, learn about it, and then share that more broadly, because maybe someone in Gorham could benefit from what someone's doing with others.
Yeah, no, that's great. Yeah, that's great.
If
So
I
this
could
is,
just make-
go ahead.
Can I just wanted to say, because it was really interesting, when we had our conversation about the work groups, that was simultaneously the reason we didn't want to go to this format, and then subsequently why we did want to go to this format is because we were struggling with taking complex issues and putting them into boxes that when we wanted to create communication. And my point of view is to avoid the whole issue of siloization, which is a huge problem in healthcare right now. And that was what my fear was. But after Tori discussed it, went over it, and Ed just said what he said, I think we can use this format to avoid silos, to avoid fragments, and then hopefully, but the problem and the issue to me that's really important is at some level, all these groups need to come together to communicate with each other. So,
Well, that does bring up an excellent point that again goes back to what we talked about in the summer is, so there was two things about the work groups, not really having a purpose and feeling a little bit like we just went to meetings. But the other part was there was never time put in the agenda to really expand on the report backs. So that's where you get your cross cutting. It's like, so, we come back and say, this is what our access is. And then Ed says, well, I actually do that and this and this. And that's where those kind of things happen. I just don't think we ever got to that point where we could really have that talk as a council. And to me, that's one of the big reasons why you get together as a large council, is to kind of share all those things back and forth.
can I ask a question? Is 3 months pilot long enough? And there's people way smarter than me on this, and I'm curious what y'all think.
I'm interested. I don't, Tori, that was a number that you came up with. I don't know if you have a thought on it. I have several, but you're smarter, so.
I absolutely not smarter. I'm not wedded to 3 months. I think it was a timeline to make it easier to swallow for folks that were uncertain about the possibility of energy going there. So.
Yeah. No, I think that's a great point. And actually one of the reasons that swayed me, but I think 3 months is, you could call it a check-in point. You don't necessarily have to say the whole pilot is over. It's like, I think it's just a good check-in point. It's going to kick us a few meetings to get going. I think it's just, when we do our report outs after that third month, maybe we, make a decision as a council as far as like whether we're on the right path or not.
That makes sense. So it's really not a pilot per se. It's just really, we're going to assess.
I mean, we're going to check in, we'll have we can talk about this in a little bit, but again, we'll have a council meeting after, after each of those times we meet, and we're checking in then. It's just a matter of, I thought Tori really was on target when she said it's a nice time frame for us to be able to just say, is this working? Go ahead, Ed.
About the work that gets done in the work groups. You may want to think about how we frame it and how they do their work in a manner that, from a logic model, their work is specific, it's measurable, it's actionable, it's realistic, and it's time-based. So we kind of have a sense of time. What can you accomplish in 90 days? That gives us a sense that we should keep going in this school. When the reports should reset your sales, look at your map and compass and figure out.
Yeah. And I think one of the things was that the group talked about was that I think the timely piece is huge. But I think it was also just, again, how do we don't want to make it siloed, but we do want to make it so that people, and I think this is actual work. One of the points that Tori made that sold me was, it's like, we have a SHIP plan, we're just not working with it. So it's like, this allows you to actually, there are sample strategies. I gave you just some, but it goes further in the SHIP plan. So it gives you a framework to be able to say who is doing the work, et cetera, all those kind of things. So I think it was brilliant. I think it's a good idea.
I'll just add some of what's been shared already. From the Monadnock region, we have at least 6 community health needs assessments that are required in different bodies.
Wow.
We have our regional public health network has a community health improvement plan. So we've got like 6 community health needs assessments, one CHIP, one community health needs assessment. And then we do the same thing with work groups. So we do work groups based on the health outcome we're looking to improve. So active living, behavioral health, food access, healthcare access. And then we layer the equity lenses on top of those based on what the needs tell us. So that's where we look at population. That's where we look at place. So that's where we bring in our older adults or our specific municipalities based on need. So these categories for work groups make sense to me, but I do think it's thinking about what equity lens goes on top of that. And then for sure, the measurable outcomes, what do we expect? And then for the 3 months, I think it completely depends on who's leading it, who's gonna set the doodle polls to get the schedules going, how quickly do the schedules happen? Is it weekly meetings? Is it monthly meetings? Who's facilitating those meetings? Like, you can get a lot done in 90 minutes and you can get nothing done in 9 years.
Yeah, I think this is Monica, right?
Trisha.
Trisha, I'm sorry.
It's
I
the
can't see
same
you.
for Monica. It's the same for Monica, though. In the Carroll County area, we do have 3. We're a smaller location, but it's the same setup. So,
Yeah.
Yeah, I mean, I think those are great points, and I think we heard from people that, the bad facilitation, the not having a great, agendas, things like that. So, I mean, I will be the person that sets up those initial meetings for people. But then, and I'll try to be at each one of those work groups, depending on, what other job duties I get thrown at me. But I think it's, it'll be I think it's our job to probably figure out that each work group is going to have some internal leadership too, that they can choose, that really makes sure that the work gets put forward. I think, I don't know, I'm curious what people think. Like, I felt like, I had Tori and Megan and D Daly and a bunch of people in my group that I felt like were really powerful. I think they probably could have done a better job. I don't think Brandeis had the background to be able to. It would have been nice if they were there in support, but I think that the people that were in the work group probably need to run the work group.
And I asked, this is a logistical issue, but I'm of the belief personally that meetings work much better when people are in person, but I know logistically that's probably almost impossible. What are your thoughts about, I assume this is going to be kind of more likely a Zoom type format, or am I getting way ahead of myself?
Whitney and I have actually talked about this recently. I think it's probably, I don't like to say to each work group what you should have to do, your old adults and professionals. I think if you can work it out so that you can meet a little bit in person, I think it's incredibly beneficial. But again, we also have to understand we have people in the north, Ed's up north, Bobby Bagley's in Nashville. There are things, there are realistic pieces that you can't give up a whole day for an hour meeting. So I really feel like the work groups are going to have to work their ways, form their way through that with some help.
Kim's got her hand up.
When it gets to the work groups, if I understand the logistics of not being able to meet in person, and I think that if there's smaller groups, Zoom can be very productive as long as people can speak openly. And that's what I find in these commissions and committees is people sometimes feel like they can't really describe their concern well enough because it's a large group of people, and if they stumble over their words, it's recorded, that sort of thing. So I think that if there's an open ability to just speak openly, and sometimes we get corrected in those in very good ways, like we get more information that we would have not wanted to ask.
I think, Kim, that Ed has sent out, I didn't send out to the group yet because there's a few options we can use, but there's a basic charter, I think, that I can help each work group fill out. And that's kind of where you put in those things like come ready to speak openly. This is a circle of trust. We're not going to record the meetings. We'll do the minutes where people can feel comfortable being themselves. And I hope even in a large group, we can create that. But I understand what you're saying. Large groups are harder. So yeah, that's, again, these things have to be created and they have to be developed. And there's a certain storming and norming that's going to happen. I think even in this group, you're getting past the storming to some form of norm. But I think that, I think we can do those things that you're asking us to do.
I would agree that I've made the mistake as a facilitator. Facilitating teams, the first thing to start with is ground rules. If you spend enough time with teams, you realize a lot of the ground rules are very common. The error I made was an error of citing on efficiency and I lost complete effectiveness. I just walked in the next meeting and gave you groundings. That ended really bad. So I think it really is that, you know, this is our group. How you want this to work. And you can have 3 different groups working in very different ways. You can give them all the same project. You can get an exceptional outcome through 3 different pathways. That's fine. And so I think that the tools I look at is what tools can we, as chairs and co-chairs, provide work groups structure to be successful? What templates are helpful to you? So that you can actually do the work without having to create a framework per se. The framework, from my perspective, has to be respectful of one's competence, one's sense of belonging, and one's sense of time, you know, choice in how this works.
Yeah, I mean, all these types of things work at the speed of trust, right? Not to be corny, but that's just what it is. I mean, like if you don't trust each other. So kind of to segue from Ed's, go ahead, I'm sorry.
Nate, Dave has his hand.
Yeah, I speak with my legislative hat right now because I know what we can and we can't do, but we are a statutorily created thing and we do have to follow the rules of 91A. So transparency is unfortunately really important. There's a lot of strategies on how to be open and stuff like that. At the same point, still be confidential. So like if there's a quorum, quorums of committees can't meet, just on the side, but you can have one-on-one conversations with other people on your committee all the time to make sure that, you know, if you don't feel comfortable, like your words being heard, or you want to say something, you can always have one-on-one conversations that aren't being recorded, you know, that can totally change the way the group goes. And I've seen that all the time in legislative committees. It's like, you know, we have to be open, but I can talk to the chair, I can talk to this guy, I can talk to that guy. And we can influence the direction of where things go without, you know, the fear of public reprisal, I guess you call it, but unfortunately, we do have to follow rules.
Understood.
So.
Yeah. Understood.
If I could just clarify, I'm sorry, but this is important to me. Sure. Part of my hesitation is sensitive information about groups of people. It's not so much that we're going to say something that we shouldn't or think something we shouldn't, but sometimes the way we talk about groups of people, if other people are hearing that, they might pick up something that they perceive as a negative aspect, and then that's out there and we've done harm and not just good, and that's my concern. I hope that made sense.
It's interesting you say that. I had a conversation with somebody this morning and I was like, you know, sometimes a little confrontation is not necessarily the worst thing that ever happened. I think just making your point at that moment to say, well, what I heard was this. I don't know if that's what you meant. What we see in our profession is this, and there's nobody, you know, better able than you to talk about some of those individuals and groups. So I do feel like you have to get to a point as a group where you're like, I understand that maybe you didn't mean that, but this is what I'm hearing from that. And it's an educational moment more than anything. I don't believe there's anybody here that has that piece that they wouldn't accept some feedback. I just choose not to believe that. So, but excellent point.
Scott, I just wanted to throw this in here because I was looking at the agenda. You got a lot to go over in about.
Well, I think we're good. We had given this discussion until 12:15. And there's slides there that you can go back and look at what your work group you might want to be in. But I think the slide that's up now is probably the one we want the most information from. And the next is, so here are just some basic questions because the leadership work group is thinking you have to have a charge, right? You have to know what you're doing. So these were just questions that we all came up with as far as like each group would have to try to answer for the council. And that's where, go ahead. I don't know if that was a question or if there was just a random noise.
I think it was a random noise.
Okay, random noise is good. So again, talking about our need to actually provide input to legislation. Is there legislation that affects your strategies? Do we need a change in legislation or rulemaking to be successful? And then it goes to kind of Ed's point about, and the things that I've been talking to you all about as far as like, who's actually doing the work? And I think Tori even mentioned that before. It's like, before we get into like the specifics, who's doing the work that we're actually looking at in each of these domains? And then of course we can bring people from outside the council in. So you've got experts. I'm thinking of in our department, we have a food policy person. So is that a person that would want to be doing that? Phil, go ahead.
Just that I'm thinking back to Polly's point and the conversation that we had afterwards. Is there then, assuming then if these work groups live on right beyond the 3 months, and this is the structure that we use, is one of the questions that the work group has to consider. Does the SHIP comprehensively address the issues that we want to address?
Yes.
And if not,
Yeah.
what should the changes be?
Yeah, I think that's excellent. Yeah, because that is, again, if you look at the legislation, it says that you can make changes yearly. So, I mean, tweaks basically, not full wholesale changes. So yeah, I think, and this document has been around for a couple of years now. We're almost, we're over 2 years. So it's like, it's pretty normal for one of those things to have to be changed after 2 full years. So I think that's great. We could certainly add that question in.
Can I ask a question or add a question also? I'm fully aware that there are never any unintended consequences of legislation, but we're dealing with some significant healthcare legislation nationwide. And there's one thing to look at proposed going forward legislation, but what I think is important to look at the ramifications of legislation or executive actions that have already been made.
Sure.
Because I know some of the other legislative groups that I'm in, we never even look backwards. We're always looking forward. And sometimes you really got to assess, not just propose.
Well, and again, that goes back to that evaluation piece of like, yeah, we should look at what has the effect been. I mean, it was several years ago, we reduced the tobacco tax to get more people to buy tobacco products, but we were already the cheapest tobacco product in 3 states. So we just lost revenue. So, I mean, that's one of those things that we should have looked at. We didn't. So it's a good point.
Impact of legislation on your domain, current or proposed. Because there could be current legislation that's currently active. It could have been passed 10 years ago, still active, and it had an adverse impact on the domain. And we should think about when we do it with that. Bring it back to a legislative body to do something about it. So it's temporarily broader.
I have a question for you, because if you say passed, and if a legislation is passed and signed, become a law, it's not a legislation anymore, right?
Cool.
So we have to obey what the law said. But
you can change it.
I mean,
yeah, you could repeal it and change it as, I think that would be one of the things.
I see what come to play, right?
Right.
Thank you, so that we can engage our elected officials to say we want this to be repealed or changed.
Exactly.
But I just wanted to clarify that when we say pass legislation, there's not such, I think, in my understanding.
Well, it depends if legislation and law are synonymous or not. Now I gotta go back to Oxford's dictionary.
I don't think so.
It's only legislation until it's passed, then it's law?
Statute or laws,
Yeah.
That's my opinion, and that's my observation. But you said I'm right, so I'm right.
I think so.
No, you-
I just wanted to chime in. So just in case people aren't able to quickly remember what's in statute around this council or law, is that there's a requirement for reporting annually to the legislative body, that they're the Health and Human Services Oversight Committee. And it's part of the statute that we will report on policy or, so existing statute and legislation relative to the SHIP. So that would be a really nice tie-in with our, if the work groups were to do that. And then because typically I think Scott wrote the last report to the HHS oversight and Dave and I presented. I don't think we really hit on much in terms of actual policy. It was more just like an update on where we were at with the development of the plan. And
you know why that's so important is like, for example, there were 2 key pieces of legislation this year dissolving the Office of Healthcare Equity and also the Vaccine Association. I mean, those are like, I'm sorry, I'm saying this publicly, but really stupid pieces of legislation when we as a group have said, or somebody has said, these are important issues that maybe need to look at, and then say that to that body and not put it in legislation, and somebody could look at it and find out, they're fine or they stink or whatever.
Yeah.
But to have done that in legislation, Stinky, and what we can do is do that, what you just said.
The other thing that's good to know is we typically end up on the calendar for November or December, which is actually pretty good timing for when the legislative session is really like kicking off. Like that's when we get scheduled to present. So working kind of thinking about a timeline for work groups, that's also like something worth thinking about. Kim's got her hand up.
Okay,
Scott.
go ahead.
Whatever you want to do.
When it comes to the groups or organizations that are currently doing the work, I think it's super important to involve the direct care givers or direct providers and not agencies that are removed from those in a regulatory point perspective or just an administrative perspective. It's the boots on the ground that we really need to gather. How are these populations being affected by these issues? And at the same time, when these work groups get to that point, the last thing I want to see is have, for instance, family caregivers come in to testify yet one more time in a series of decades that never gets anything accomplished. So it's a really important but a sensitive piece of this discussion.
If I could add to that, the most important work we do is not passing laws. It really isn't, because you don't need to pass a law necessarily to get something done. I mean, bringing people together to look at holes and stuff, I think that's where it's done. We're doing our important work ad hoc, and we're gonna get a lot done.
Yeah, and I think one other piece, and this is, I always think of Phil when we go to this piece, but it's like, we're supposed to make recommendations on, you're getting the policy, legislation, et cetera, but it's also supposed to have a component about cost effectiveness if that's at all possible. So I know Whitney and I were talking this morning about, is it something that we're really looking at a pros and cons approach of like, this is what the legislation either is, or, and it's like, again, this is the effect, kind of like to Dave's point, there's very few laws are every 100% positive. There's always usually some kind of a negative in there. And would it be more, I'm thinking of you, Dave, would it be more palatable for legislators to be able to just see the positive and negative of each?
We just had a very interesting discussion in the Opioid Abatement Commission about primary prevention. And we wanted to to me, this has always been important from the minute I got on the committee, is we need to put money into that. And I understand harm reduction is important, but at the same point is we want to prevent people from getting to that point. So we proposed putting $6.6 million towards primary prevention. And out of a $330 million budget, that seemed pretty trivial to me, but we couldn't convince people it was a good idea because it's hard to prove the negative. And we almost didn't get it passed. We did. But there was significant holdback because they said, well, you're not really addressing the issue and you can't prove what you want to do. So it's hard to measure cost effectiveness of primary prevention, which is something that we also need to look at too, but dollars and cents aren't always easy to measure. I guess that's the point I'm trying to make.
And I don't necessarily think it's always has to be dollars and cents. I think that's the easiest thing we go to, but is it more impact? Like what's the positive and negative impact of other things? I think Whitney and I did the sugary drink tax modeling, and it was, the money from the revenue was the most attractive to people, but they didn't, as far as savings from Medicaid, it was almost too granular. They couldn't really get that piece. So maybe it's just more open than that.
You look at the groups and organizations who are currently doing work. In part, they're doing work that's consistent with the shift. May not be aware that there is even such a thing. I think it's important to tap them on the shoulder, say, where do you go with? We need to find a way to elevate so other people can see what you're doing. Don't know what that would look like, other than some form of appreciation and gratitude, awareness, so that the broader public can see what they're doing. And, this is what the needs assessment, this is what the state plan was. Oh, by the way, I can take you up to the Durrell Methodist Church in Bethlehem in 2015, had a community meal. It is a piece of the food security, and it predates the shift. If they're still doing the work, they would front run it. And outside that community, there are probably very few who are aware of, so do we have a sense of when we think about food security? Who all's doing good work? What are those assets? And I keep coming back to those hyper-local assets in communities. You don't do a good job as a state of collecting and curating those assets so they don't get stale.
Yeah, and I'm hoping, again, that's why we wanted to ask you all about the questions that the group came up with, because I think that's one of the things we want to find out is where is the work being done? Kind of to Kim's point about there's a lot of things going on well below the regulatory agency piece that we don't know about. So,
and we actually were proposing a separate committee that's a subcommittee that's total job was to give people pats on the back for doing great things. I mean, every work group here can do that. So it's part of it.
Yeah.
And then that's important. People want recognition and need it.
So I think it's a good segue into, again, a conversation I believe, and please leadership work group folks, let me know. I think we had talked about monthly meetings with work groups and then going back to the every other month to check back in with the council. How does that sound to people? Just to not meeting you out.
We have a thumbs up in the room.
Thumbs up in the room. How about anybody else?
Couple thumbs.
Well,
some of those are leadership group folks.
Thumbs on those,
I know. All right, fine.
Yeah, I think at least I think we can start that way, and then as part of our kind of evaluation, we can come back and say, hey, is this working for people? That might also help our attendance on council, meetings. I mean, I think you guys did a fantastic job getting here today on pretty short notice. So I think, again, we do a better job of planning out our every other month, and then once we get the work groups going, I don't think that's going to be quite as hard. It's just getting them off the ground. That's really the hard part. And then the last thing I think from this particular point before we move on to me was just, there are people that do better jobs of evaluation than I do. There's many people. What does success look like? What should we be evaluating over this really every time we meet? But go ahead, Kathy.
I just have one question.
Sure.
Have you already assigned people to the groups?
Absolutely not. I believe the leadership work group had said we would have people choose at least one.
Okay.
You can do more than one if you're really super psyched. I've got Phil on about 5 or 6 of them. You didn't ask me to, but I just put them there. But I think we're actually really just hoping that folks will find that.
So do you want
niche.
us to email you which one?
Yeah,
we
I
would
will send
want?
out, just so that people don't have to, feel the pressure to do it at this moment. When we send out the meeting minutes, et cetera, I'll send out the recording. I'll just make sure that please, just remind people, please, to get back to me. We'll find a date. Usually by January 1st, we should be able to make our minds, and then we can figure out how best to get everybody together. I can, it will be my job to at least get you coordinated the first time. And like I said, I'm going to try to be at every meeting schedule permitting. So yeah, that's a great question, Kathy. So moving back to our evaluation piece, I don't know if anybody has any great ideas.
I'm terribly sorry, but I got a call I had to take and stepped out.
Oh, I'm sorry.
I thought there were 4 work groups.
I didn't see anything. It's fine.
Sure.
There are 4.
Yeah.
Stop being facetious.
Yeah.
Oh, 5 or 6 assignments.
Scott, do
Yeah.
you mind running through what the 4 are?
Yeah,
Because
sure.
I think we
Hold on one second.
skipped over.
Yep, that's okay.
Just,
Let me go
because
back.
people are going to be eager to think about which ones.
It's on the end.
Okay.
Yeah, I can tell. And again, each of these, I have slides that kind of details them a little bit more, but this is the big one, as far as the big 4 categories. I think we probably had the biggest group of folks the last time, like health status and outcomes seems to hit a lot of people that work here, but our access to opportunity, which was, again, housing, food security, that was a big group. The ones that we didn't really do much with last time were actually the 3 was actually 2 and 4. Let me pull those ones up because we got a couple seconds. Was community. So community was social services and support, safety, environment. There was again, a big push around PFAS when the ship was actually being created. That was a big time for PFAS kind of things that were going on. So there was an environmental contaminant piece to that. I'm not sure I think we do Andy's our, if I'm not, am I correct, Andy? Andy's our kind of an environment specialist. But we may not have as many folks that have that.
We've
focus.
got a hand up.
Yeah,
Kim has a hand up.
Go ahead, Kim.
Yeah, it's a difficult one, but
No.
I think about the folks that I'm most concerned about in this state and the health improvement plan. This looks a lot like what we did kind of already, where you break it up into these broad concepts. And I worry that that's where we lose people like Polly, because we're usually here from specific specialties. And so I don't know much about mental health services delivery, so I would not want to try to assess that on A, B, C, or D. But I know a bit about persons with developmental disabilities. I know a little bit about seniors. I know somewhat about veterans a little bit. But if I had an assignment to work on, okay, how does the SHIP apply to persons with developmental disabilities? I'm already ahead of the game because we've done this, we've thought about this, I've interacted with this. So is there a way for those of us that really have more of a focus on individual vulnerable populations to do this differently? And I know this is late in the conversation, I'm sorry, but if you told me you're going to work with 3 other people that want to do this and they're going to look at the needs of persons with developmental disabilities across the state, and we want you to evaluate how the health improvement plan relates to them or, gaps, I could start that tomorrow. But if I'm looking at the whole state on A, I don't know, I feel like that's the process we went through the first time, and that's where we lost people.
If I could respond, really great point. I'll be honest, we did wrestle with that a lot. The leadership meetings, I was struggling with that, but one of the things that and you can tell me if I'm wrong, but I did bring this up at the leadership meeting, was that when we had them running it, they were running it from a somewhat dictatorial point of view. I always felt like I was challenging them all the time. I was just way too much energy to say, well, I'm not sure this is the right way to look at that or whatever. And we also believe that they were so focused on a report that they weren't looking at the substance. So what we think is that these groups will have a lot more freedom to address those types of things than the previous groups did. So we're hoping that we don't go down the same road again, but I totally get what you're getting at, because
This was a fluke.
Yeah, I think that, and again, Kim, the feedback is
2019, and Joe Porter Katie Bear experience. It was a totally different experience. If you didn't experience that, I'm sorry. Sorry for the PTS at the time spent. And I get to say this because I spent 10 years of my life in academia, so you're allowed to throw stones in self-deprecating.
I want to get to Tori. She's got her hand up.
Thanks, Kim. And Kim, we've worked together a lot, and I would never recommend something that's going to hurt. So I think what we talked about at the leadership group is that it is not the expectation that the subcommittees do all the work. It's that the subcommittees have connections to tap folks with other bits of knowledge and can bring that in. So I don't think that you need to worry about I only have subject matter expertise in a narrow area and I can't speak to the other areas. The hope is that the expectation is that the work groups can identify additional partners, collaborators who can provide a little bit of technical assistance when it's identified at the committee level. And that's what the first 3 months are for, is to figure out if that actually works or not. Because I do think we have a lot of expertise at the table, and just trying to figure out how to organize it so that everyone feels like they're contributing at the top of their scope of practice is a challenge that I think is a really important opportunity for us.
And I think that expertise that you have and Kim and others, it's like, that's the two-way communication. It's like bringing that back in, what you know, feeding that back up to the council as a whole, and then that goes into recommendations. So that's the whole point that we hope, is that it's not just something that we're just working on the same thing we've always worked on, because I can't stand that, to be frankly. Great points, though.
I understand there's deficits and always be deficits. I will never be engaged if that's all we ever do and if we don't focus on what's actually working. Otherwise, it feels like doom and gloom all the time. And having spent time in this thing, that's actually not accurate. It's their own thing under it. So we actually need to be bold. Why I get frustrated is having 20 years in the community with ongoing needs assessment and nothing changing. And then in some sense, people expect somebody else to change it for them. It's your community, no one's coming. No one's throwing you a life jacket. If this is all you have, what do you do?
Yeah, we're at time, guys. I don't know if anybody has any last minute, really. I'm happy to hear any comments. I'm always happy to hear comments after the fact too. But as far as, everything we talked about over the last 45 minutes, I mean, my action items are to, again, get the ask out to the general group, and then we can really start to at least begin to organize these groups and then work with them to try to set up a structure that works best for them to get what they want done. I mean, I think I'm kind of with Dave. I don't really like to be predictive about what's going to happen. I mean, you're all experts, so I think it's important for you to really figure out what's the best way to work. So not hearing any comments, I've been picking on Whitney every month. It gets a little old when you're trying to start $1 billion project and somebody keeps telling you to come in and present, but we always appreciate her input. I think there's a lot of crossover between these particular work groups and the work that she's trying to do. So I always love to have her come in and just give us a little bit. Even if she doesn't need 30 minutes, we'll let people go early. It won't kill anybody. So we won't hurt anybody's feelings.
Okay, so I don't have any slides. And I did put in the chat that I don't think I'll end up needing 30 minutes. So if people want to have more discussion about next steps with the work group, that should be fine. So just hot off the press, I just got message that the fiscal item for accepting the rural health transformation grant funds into the state budget passed just in the last hour at fiscal committee. It passed GNC, or Governor and Executive Council, on Wednesday, which is a good first step.
So that's the 100 million.
So I don't want to bore people with all the bureaucracy. The fiscal item was for the amount of funding that we would want to be able to spend between now and the end of our state biennium, which is next June. So the total, I think, was 238 million. So that's for an 18-month period. The fiscal item went through with we want permission to spend up to this amount, and that we would come back with a memo to just let them know our actual award amount. So that was that's the sort of wah. We were told that we would hear from CMS in December, at the beginning of December, and that we expected that they would give us a budget amount and we would negotiate and revise our budget. Instead, we have heard from CMS, and they've sent to states their questions on the application. I don't know if we had this from the last meeting, so I apologize. No, it couldn't have been, because we met in November. So the good news was we got one question on our entire application. Yep. Which, again, as a person who's worked in grants for decades, that's pretty wild for a grant of this size. So one question, they wanted to know how many wheelchair vans we were going to be purchasing, and that was it. No questions on anything else. And so they are statutorily required to give us our notice of award with our funding amount by December 31st. So at this point, we anticipate that that's probably when we're going to get our notice of funding. Yeah. what else is relevant for this group? We posted the project narrative. Now it's publicly available on the department website. So that's the 60 pages that were describing how we would use the funds. I think Scott updated the agenda for this
It's in our
meeting.
new and revised agenda that went out today. Yes. Yeah.
Okay, so if anybody wants to read that, I will say, and I said this at our previous meeting, it's a $1 billion grant application, and we were only given 30 pages essentially to describe what we're going to do. So you're going to read it and be like, I have so many questions, like what is beneath all this? So I think that's the sort of more to come as we get our final budget and we start to roll out the implementation of the grant. Just as a reminder, the process for developing the grant was very inclusive. So there were lots of community meetings. There was a request for information where we got over 300 people inputting, their suggestions. Do you have is your hand raised, or you just?
It will be when
You're
it's
okay. So.
Sorry, I always sit like this.
That's fine. What I would say is that if people are perusing the narrative, you'll see that the SHIP Council, so this group, is named in the narrative. It's named as being charged with thinking about, so part of the narrative was developing the Rural Health Transformation Plan. There's a ton of overlap with that and what's in the SHIP. And so in the narrative, it's said that the SHIP Council will kind of help to think about where that alignment is between the Rural Health Transformation Plan, and that we will be tasked with kind of keeping an eye on the impact of the Rural Health Transformation funds on moving those metrics. And then the other piece that's in there, and this could be interesting. Do I have a page number for reference? I'd go Control F and look for SHIP. The abbreviation is in there for SHIP. Actually, Scott and I were looking at it earlier today. It might be page 40.
I'm gonna try to do the control. I'm gonna try to help Polly out a little bit because Polly's cool. So.
The other thing that's named, and I was kind of perking up at the conversation earlier around, like, we have 8 million plans and, local groups and state groups. And so there was a real, I've talked with a number of people who were like, as we drafted the narrative, they were like, please don't create new regions and please don't create new plans.
Yes.
And I'm seeing physical relaxing in the room. So that tells me that was right. And I think to Ed's earlier point, it's really finding the alignment across those existing plans. And so that is the hope and the vision that maybe we can even use this council to do. And Ed and I and Dave, we're going to be presenting at HHS Oversight today, but I got us pushed out till January. But I think we had planned to even kind of capture that exact alignment. Ed was going to talk from the perspective of an FQHC, and I was going to talk from the perspective of the department and the alignment between our roadmap and the SHIP. So there is this emphasis on supporting, we call them regional governance groups. They're not a new thing. It's just saying at a local level, there needs to be coordination and alignment so that we are successful in the implementation. And we said that the regions would be the public health network regions. So no new geographies. Let's see. Phil's correct. Okay, page 41 is where it is in the project narrative. Part of the narrative mentioning the SHIP Council also is helpful because the budget, which is not posted at the moment because we want to have the ability to negotiate and go out to bid and be competitive. But within the budget, there was funding allocated for support of the SHIP Council, with the thinking being that, Scott is fantastic and, Scott, people don't know this, Scott actually has stomach sickness, he has that norovirus
They
right now.
don't need to know that. They don't need to know that. Oh,
He
God.
didn't know it from this, but that's why he's not in the room. So it's like, yes. So But
I just
we
didn't want to
also-
infect everybody for the holidays.
It's very thoughtful with the
Thank you.
holidays coming.
Thank you. I
But,
appreciate it.
you know, if we are gonna like roll back out these work groups and we're gonna have this additional charge, like I am, you know, I have worked for years in groups that are just volunteer driven, and that can be where things get really hard because everybody's busy and you want people to be able to engage, but with like adequate support so that it's not like a huge amount of extra work. So, I see, I'm trying to monitor the chat, but that's
No,
a
you're
long
good.
one. from
Yeah,
Phil.
Phil
He's
just
sharing
said it was a
what
mention. It was a mention. Yeah. Yeah.
So I don't know, again, I didn't prep slides, but I would
The
love
one
to
thing I
hear,
would,
like,
I'll bring up, because you
Oh.
might have a word on this. Polly mentioned developing a baseline population health data dashboard. I know we've talked about that a little bit before, so maybe that might be something you want
From
to
page
just,
41.
yeah. Yeah, thank you. Not 40.
Yeah. And so, I will say, if you look at the project narrative, CMS did not hold us to a very like rigorous set of metrics in terms of what we were committed to changing. We were required to pick 4. And there was a lot of strategy around what we chose because our funding will get clawed back eventually if we don't show progress on those 4 metrics. But there is an entire section on eval, and we're definitely committed to monitoring and measuring impact beyond the 4 required metrics. But I think even those metrics, again, we had about 3 weeks to truly write the application. Those metrics even need to be drilled down on. We have things like preventable ED visits. Well, that's a really broad category, and by region, it's going to vary what's driving preventable ED visits, and we want to then understand like the other side of like beyond the data, that kind of lived experience of when I presented someplace else, somebody pulled me aside after and said, well, you know, my mom's going through cancer treatment and she gets admitted to the hospital so that she has more rapid access to MRIs, but it's not technically, you know, a necessary. And so I think we need that other side of the metric, that like human experience of like, yeah, well, this, to get to the point of like, well, what needs to change to actually change that, you know?
ED visit may be preventable based on the movie provider date.
Yeah.
Doesn't movie provider date.
Yeah. So you have to tease out all of that.
I don't know, for some reason we're not hearing you, Ed. I'm not sure why. It was doing so well for a while, but we're not picking you up.
So I can just kind of reiterate. Can you hear me?
Yeah.
Ed was just making the point that there's also like coding, you know, coding is behind those ED visits, and there may be other drivers of what leads to certain coding that, you know, again, we really need to dig into the detail to truly understand the picture of those metrics.
Yeah.
Yes.
This will be an entertaining process because I really struggle with the whole reason why this rural transformation money was created in the first place. With that said, with the Medicaid cuts that we're seeing, we will definitely see a transition and, you know, the loss of insurance, we're going to see increased ER visits.
Yeah.
For sure.
Yeah.
And so the prevention is restore the Medicaid funding. I mean, you know, so we're going to hopefully be able to go back to the federal government and say, you screwed up. But I'm curious how that works, because if you could easily get graded for basically doing what they created.
Yeah, I think it's, so what I've been describing as I'm like talking to folks like the, that are going to be working on eval and drilling down into the data, is part of it is that we just need to even be able to paint that picture of like, well, here's what actually has happened. You know, here's an uninsured rate, uncompensated care. We may see some ED visit types that we do reduce through the I'm certain there are some things that we can see a reduction in. But again, yeah, we're going to have to paint that picture because we can't prevent the context, that bigger context that's coming. I I'm going to do a plug for Phil. I don't know if anybody else listened to the most recent New Hampshire Fiscal Policy Institute podcast episode. It was like an end of the year summation on like data and trends in New Hampshire. It's really good. I highly recommend. Maybe we can send out a link to it.
Sure.
Phil was on it. But I think that kind of context too, like, so they're talking about what happened in housing and what happened in the state budget in the department. And that's a part of the picture that we'll have to share with CMS to just give that context. Phil, I don't know if you want to add anything from your podcast episode. I'm loving the whole series.
Thank you, Whitney. Thank you for listening. I just put the episode link in the chat, so feel free to reach out for anyone if you have any questions about it.
They did a really nice job also highlighting the ACA subsidies and the impact that that will have in the even more short term in terms of potentially people choosing to not have insurance because of the costs. So I think it was like people might have double the premiums and about a third might opt. Yeah, I don't know. I can't remember all the numbers. I bet you can.
Yeah, there are a couple example households, right? And the Kaiser Family Foundation, or KFF, I should say, since they've renamed themselves that, does provide a couple examples of, for example, if you're a 40-year-old living in New Hampshire with $32,000 a year in income, then your premiums will go up $122 a month. If you're a 60-year-old couple, or there are two 60-year-olds in a household making $85,000 a year, then your premiums are going up on more the order of like $800 a month. And then you're talking about, $10,000 a year that you're finding, or additional $10,000 a year in your budget up to that you're finding. The average premium increase, and these are older numbers, but the average premium increase for people on the exchanges nationwide is 114%. In New Hampshire, it was a lower percentage. I had seen 60%. But there are a lot of households for this is suddenly like a much larger part of their budget now that they will have to absorb. These are still the same tax credits that the American Rescue Plan Act had as structured originally in 2010, but the enhancements that were passed in the American Rescue Plan Act and the Inflation Reduction Act are expiring. So that's a big cost change that's starting next month for households. So yes, we did talk about that. If people have more questions about that, I'm happy to send resources too.
Kim's got her hand up.
Well, I just have a question about when we're looking at how the effects of all of these cutbacks and stuff. Is there any portion where we look at the increased requirement of municipal services, emergency services? Like if we have people not getting health care and they get to that desperate situation where they call an ambulance, we're already pretty busy. And so if you're doubling the workload on municipalities, I don't know if that comes into play with your data collection, but maybe you want to consider it.
Yeah. And we're working, I don't know if Justin is still on. I think he maybe said he had to hop off.
He had to hop off, yeah.
But yeah, so one of the big and again, now you can see the project narrative because it's public. There's a big emphasis on partnering with EMS and building out that system in tandem with the work with other healthcare system partners.
I have a comment and a question. So a couple of weeks ago, I was honored to get invited to the White House to meet with people that were making decisions. And there was somebody from CMS there. And when I raised my hand to ask a question, I mentioned I was from New Hampshire. She came up to me after and said, "You guys did a really great job."
Oh,
so I wanted you to get a pat on the back because that was really important. I did want to ask this question of you again, and I know I've asked it before, but I did ask them very specifically. My concern was, are we ignoring the inner cities with what we're doing here, and what are we doing about that? And you have told me that we can use that money in certain circumstances for inner city issues. They told me we can't. And I'm curious if you could reconcile that.
Yeah. So I will say, again, we're waiting for our notice of award and we'll truly get feedback from them at that point in time. We usually get what's called a technical review that comes with our notice, and that's where they might articulate if anything's outside the allowable use of funds. The fact that they didn't ask us about anything leads me to believe that we were within the allowable use of funds. It's going to be a little bit of game of figuring out how broad you can go in the non-rural communities. But eligible rural entities under this grant include all FQHCs and all CMHCs. And we know that the people that are served by those types of entities live in the communities more broadly than just touching CMHCs and FQHCs. So we're hoping that we'll be able to, more broadly implement things. The other piece around that, it's gonna like skip my mind. Oh, we're also hoping that we'll be able to like reason with them to some degree around like volume for certain things. So we know that like in some cases, it might just be beneficial to be able to implement things statewide and in more urban areas, because if it's like a statewide thing, we need the volume of those populations to be successful.
Because I'm sorry, I want to overstep my bounds, but I'm going to overstep my bounds. So I would argue, we're dealing with this whole issue of like, access to care in rural areas for like really specialized treatments that really don't make any sense to locate in a rural area because, you have to do so many per year to be, to be functional. So, I mean, my belief is that we need to focus on, primary care and that kind of stuff and leave the specialty care to more of an urban area. So that people, in rural environments will have to travel for that, which to be honest, that's what I do and that's what I see. So I know they don't have a problem doing that. That it would seem to me that money should qualify.
Sorry, to support specialty care that's there is in the grant, inclusion of telehealth specialties. Yes, that would be supporting the specialists in wherever they're practicing, but so that they can then be delivering care through telehealth.
And I will say, I will overstep my bounds again, but 40% of my job time is spent doing telehealth that I don't get paid for right now.
And that's part of what, that's the really nice thing about the way this has been rolled out so far, is that the grant for New Hampshire was co-led by the Medicaid Deputy Director and the Public Health Deputy Director. So it was sort of, finance was always considered in everything that we wrote in, because we didn't want to build things up that then weren't sustainable.
How I see some other telepresence. In the state of New Hampshire, payment parity is codified in statute for Medicaid and for commercials. If one's not getting that, it's a different conversation. CMS keeps extending things. Not certain you can put the toothpaste back in the toothpaste tube, although they'll probably try purchasing this. They tend to lag behind, so it is we as a state are actually during the pandemic for telebehavioral health, our no-show rates went to 0. So there's that. So now that we're in a different world, it's actually the people who are most reticent for telehealth and not the patients. Providers are human first. They come with a license second. They come with all the frailties and foibles of the rest of the humans, including the innovative their lives. Change management with providers is extremely difficult.
No show is 0?
It was 0 during the pandemic.
I'll tell you, I learned my lesson with elderly people is you call them twice. They don't make it to the phone fast enough the first time. And you call back right away. And then you get 100% rate, otherwise you don't.
So I don't know, Whitney, I know we've put
Scott,
you through. Go ahead, I'm sorry.
But Monica's talking.
I can't hear.
Oh, they can't hear you.
I think fine.
No, Scott.
Yeah, she was cutting out. I don't know if it was that way for anybody else, but.
Let's fix the side of the room you guys are on. Let's all just sit right.
Hey, kumbaya, my love.
She's coming around.
Coming around. She's bringing it around town.
And here,
Thank you,
I
Monica.
just wanted to mention that there are some sensitivities. When it is mentioned that some of the funds could be used not in rural locations. So I just want to mention that that's come up in multiple meetings that I've been in. Because that has happened to us before where funding was supposed to be rural, ends up going to larger facilities or groups. And with the idea that that will help rural locations and rural people, but then over time, if you've been in those locations for a long time, like I have, like people have, you will know that that then fades away. So I represent critical access hospitals here, so I just want to mention that we do have sensitivities when the conversation turns to, can we use this funding specifically dedicated for rural locations for non-rural locations? And so I agree with the thing that you were saying, and we definitely want to support primary care, and that's why we really pushed that when the rural health transformation funding came about. But just wanted to mention it.
Yeah. The reason I asked the question of them was that, to me, it's not just rural, but urban access is an issue also. And I says, well, why did you not include them? And that was why I asked the question. And they didn't give me a good answer. Other than we're going to learn from you so that we can supply them. That was the answer.
But it's a political response to ask Mitch McConnell not to see this.
You're right.
Because he knows why.
Yeah.
And I agree. Again, coming from academia, and is treated by me. If you promise to come into rural centers, we build trust, and when money runs out, we leave. And this is why rural people do not trust city folk. First they don't.
You cut out, Ed.
It's typical of academia, and why I typically won't participate in research, aside from the fact that the academia takes 40 to 60% of the overhead. I'll never work with academia. It's my grant. I'm the principal investigator. I'm giving you 10% overhead because I'm not paying for your faculty. It's not my problem.
Well, I come from a town of 500 people. I don't trust any of you people. Like, I don't trust any of you. 500 people. There's more cows than people.
There's a lot of reasons why we had a civil war, but one of them was rural people and urban each other. So that's been a long-standing problem.
To show the urban people how to get back to Ohio.
So I don't. Did you feel like Whitney, like we've exhausted your knowledge for today, or
I actually have a question that's very substantive.
Okay.
I just want to know where the 238 million number came from, because when I do the math for 18 months, that would be 150 million plus, and there's another pool of money that we're hoping to get something from. Is that extra like $88 million from that hopeful pool?
Oh, gosh. Scott, you tried to save me by saying, I cannot remember all the like mental gymnastics. So this is how crazy this was. You had to submit to I think CMS just got confused themselves. You had to submit a 6-year budget, and then you had to fill in paperwork for a 5-year budget, which makes no sense. But it has to do with like, so you get your first year of funding, which could be up to 200 million. And then you have 18 months to actually spend the first year of funding.
Oh.
And so there's always like a period of overlap where you have access to the 1 year of funding and the next year of funding. So
Phil's got his hand up.
I think part of it too is that the item that went before the fiscal committee is even dealing on a different timeline because it's the rest of the budget biennium, right? So that's the amount that's approved through June 30th, 2027. But the grant works on primarily a calendar year, right? As opposed to a state fiscal year, or is it a federal fiscal year?
Federal fiscal year.
So
Okay.
October or something, September 30th.
When my brain works, 238 million made total sense. I would have just randomly come up with a number around that range, so I get it.
I think it's worth repeating that you have David Shorty and Whitney, who created this thing in 6 weeks. They got one question from their application, and they got one question from the New Hampshire Governor and Executive Council. That is unheard of for the level of grant that we're talking about.
Yeah.
Fantastic.
Yeah.
I tried to save you. Go ahead, Phil.
I did have another question. Just, I think you said this, Whitney, but I want to make sure. So we think we're going to hear from the federal government by December 31st if we have the full final approval? Okay.
Yeah,
Great.
that's in
Thank you.
federal statute, so we will hear, we will
Okay.
have our NOA.
Great, thank you.
Ed just said at 11:59 on 12/31.
If then, yeah.
Way to
So,
toast the new year.
so
Yeah,
thank you,
yeah.
Whitney, for always being willing to let us
Oh.
plunder you from, go get up, sorry. Good.
I know last time we discussed this, our last meeting, talking about infrastructure.
Mhm.
Anything that came out of it, like, is there, when we say infrastructure, are we looking at sewer and water, or are we, what that entitled in the development of?
Yeah, so if you, one of the best places to look for the detail would be in what's called the notice of funding opportunity, which is what they posted for us to then apply to. And that's where they say what we're allowed to spend the funding on. There's a category called capital improvements that were allowable funds. But what they were not crystal clear on was what they would consider a capital improvement. We had a couple of different like calls with CMS where we were allowed to ask questions and clarify while we were writing the grant. And in those calls, they gave contradictory responses to what would be considered a capital improvement. So they said at one point it was anything that requires a permit would not be allowed, which again, I know permitting varies by where you live as well. But so we sat there and thought, well, okay, so nothing is going to be allowable other than paint. But then they said in the same call, for example, you could buy an old hotel and renovate it for living space for healthcare providers, which would obviously require a permit. So we are hopeful that it will be the more inclusive definition. And so we budgeted a fair amount for capital improvements. But that's going to be one of the areas where CMS is going to come back and have to be a little clearer about what's allowable. And so capital improvements, I mean, we envisioned them as fairly broad. I don't know that it was per se like sewer, but things like replacement of roofs or putting on new siding on a building, like those were considered in the application to help pay down debt for safety net providers that are going to be hit financially.
We looked at it from these are one-time funds. What shelf life can you get? So if I invest it here, when's the next time you have to reinvest in? 20 years, 30 years, 40 years. Given the impact post 5 years, does that investment free up operating budget that's going to be compromised perhaps by Medicaid or VACS? That we're not just taking money out of operating budgets to do some of these physical plant improvements. So that you just don't want the money to go into a dark hole, and in 5 years you're left with your hand. It's 5 years, it's gone.
No, but if there is no, and I'm sorry, because as you said, I have to dig deep there, but if there is no guidance, and even them that creating this are giving contradictory responses, it seems like there is a flexibility in the funds. Now it's up to the state or whoever led this effort to determine which one they think qualified for the infrastructure or which one qualified based on the guideline they were given. So I think
that we usually, so it's definitely in partnership with CMS, the funder, that we have to get the clarity as opposed, I don't know if I was like, I don't want to misunderstand, but it definitely is not at the point where it's the state that's then deciding to interpret the guidance. Like they would be, nobody would want anybody at the department making decisions like that where we would then be accountable for payback if we misspend. So it will be clear direction from the federal funder. This happens in the writing of if anybody's had to deal with contracting with the department, you know the weirdness of when you're in like procurement, everybody's like super secret and can't talk. And then all of a sudden, once you've got your actual contract, it's like, oh, hello, let's actually help and be clear. So we're in that phase with CMS where they're not as able to talk, you know, with us. And come January 1, we'll have open communication.
Thank you.
Whitney, Tori just had a quick question about whether the, what was the clarification for the redactions in the narrative? Yeah.
Yeah, the redactions are named entities who provided us with budget information and other details that was considered and not legal, but like proprietary information. So that is the only stuff redacted is named entities. And again, the budget, we thought about putting the budget up, but the whole thing would have been redacted. So it's, yeah.
Do we have any considerations for what our work groups are doing and the outcomes of those that might be eligible to apply for any of the funding? So is there a timeline we have to consider in the work we're doing in order to be able to potentially access any of these projects that you're working on, or?
That's a great question. The way that, so there will be flexible funding, hopefully coming out through one of the first contracts that goes through, which we're aiming for the end of January, which seems like
incredibly fast. Yeah.
Yes, it's incredibly fast. But I think like the pilot, the period that was contemplated for the work groups of the like 3 months is plenty of time. Like, I don't think any funds will be distributed to like a local level through those regional groups. So I don't think you have to feel like there's a timeline that is already missed or is going to be in January or anything.
Okay.
Did I see another hand or no? I think not.
Now we're getting close on time. So it's that time when we have asked for public comments. I've made a lot. I don't know if Ben Chan's still with us, if he wants to make a comment, but this is the time that we ask.
I think he said he had to scoot.
Well, he scooted then. So far, that's the end of the public comments. The last thing we have is any last thoughts before we move on to the rest of our holiday
Dave,
season, etc. Dave?
I have a one last thought, if I could. So yesterday, before the state legislature, I gave a presentation or a speech or whatever you want to call it on Native genocide and ramifications for New Hampshire going forward. One of my campaign promises was that I would help create a native health system in New Hampshire, which we don't have. I've been it's been difficult because I've been shocked by the barriers that are away, not the least of which we don't have a recognized tribe in New Hampshire that we're trying to get. For example, there's 220 native tribal bands. Which leaves people the impression we don't have a native population. We actually did do an indigenous health needs report that we published 2 years ago. We looked at the whole issue of them, and I'm just, the only reason I'm even bringing this up at all is that this is an issue that seems to get forgotten a lot in New Hampshire, and between the rural health money and what we're doing here. A lot of the groups that I work with, like the U.S. Pain Foundation, is a very important part of what we do. So I would like to have us remember that they are important. And we can work together.
You're cutting out for me, Dave. I'm not sure if it's like that for anybody else. Yeah. It's, for some reason our audio is failing. I think it's because it's close to 1 o'clock.
It's just something that as we go forward, I want us to remember them, because we're talking about the elderly, and that's an important group, and the rural group population is an important group, especially since this whole state's rural. But I just wanted us to remember them going forward. It was just kind of an emotional thing yesterday, and to be honest, I was shocked with bipartisan agreement and discussion on the issue that happened afterwards. I almost fell over when that happened, to be honest. I was expecting rotten tomatoes, to be honest, but it was a very positive thing, and this is a group that I think we can work with that, and there are people that we can work directly with on these. Thank you.
Yeah, sorry, my dogs are going nuts here, so must be mail time. Yeah. So yeah, I'll get the information out about the work groups, and feel free to contact me if you guys want to tell me what you want to be a part of. But and
Scott,
other than that,
I think Tori had a question that Whitney
oh,
was
I'm
gonna
sorry.
answer,
You're right.
so-
You're right. Thank you.
Yeah. sorry.
Yeah, Tori had a question and then Ollie had a question about when we're meeting next. So you can think on that and I'll answer Tori's question. Or maybe you already know your answer. So the question in the chat was, could I speak to how Go North, which is the governor's office of new opportunities, rural transformational health. I'm never going to say that again. It's Go North. And then just the point of, Gopher was this other version of a governor's office. So for people who don't know, I don't even remember what Gopher stood for, but they are still in existence and they distribute ARPA funds. And apparently they distribute like 200 or 300 different agreements. So it's a lot of just moving money. And then like contract compliance, they're funded through Treasury, which is very different than CMS. So Scott flagged this for me. CMS is the Centers for Medicare and Medicaid Services. So it's within DHHS. It's very different than Treasury. And there's an emphasis on making the actual impact to health that we committed to. So to Tori's point about, how is Go North going to leverage DHHS subject matter expertise? If you are interested, there's an executive order and it speaks to it. What they're really doing is pulling a number of department staff into the governor's office to work on this grant temporarily. So to her point about, will it be a bunch of lawyers or is it going to be people that have already been working in this space? The aim is really to have it be led by subject matter experts who do this work. And again, when and if the budget ever gets published, there's only contemplated 20 contracts for this entire grant as opposed to Gopher, which had, like I said, 200 plus. And so there are, I don't know when it will become public, the org chart for Go North, but there are a number of like leads that have subject matter expertise in things like behavioral health, population health, the technology purchases. So again, it's going to be a very different staff than what Gopher had. So hopefully that answers Tori's question. Any
Yeah,
other
and then
thoughts?
Ollie, we're just trying to do work groups in January, and then we'll meet with the big council in February. I think we typically do the third Friday, 11 to 1. So, but that information will come out. You do not have to remember it. So, just only thing your job is to get me what work group you want to be on, and we'll get those coordinated. So, thanks, Dave.
Sort of a pragmatic question. So, it's obviously an important legislative time. This is the rule I don't know. Like if I'm on a legislative standing committee, I am not allowed to send an email out to everybody to promote discussion.
Yeah.
For us, can I do that? Do you know?
Are you asking, can you email the
I
entire
just want to
group?
email everybody for legislative feedback. I can't do that, right?
Not technically, yeah, like, I don't know, you could make everybody's email addresses.
If I blind copied it, can't do that either.
No, because it's considered doing business out of public record.
So I can't do it.
Isn't it okay to send?
Polly's talking. Yeah.
Isn't it okay to send an email out but not have a conversation? So you can't reply all.
Yeah.
So if you wanted to send something out to everybody, I think that's okay, Dave, and just make it clear to not reply all if people or blind CC the recipients. And so somebody can accidentally respond.
Because I'll tell you, this is an important time and I need a lot of feedback from you.
Well, and again, we may be able to just use the council and I'm the one that sends it out. So, I mean, I think there's ways to do this.
All right.
I played with it.
So I'll work with you on it.
Played with it a little bit, and it's like having a cheap research associate. I would look at the legislation titles, I would grab the ship, and I'd ask AI to show me in rank order the legislation is most closely aligned. It's the fastest, cheapest way you're ever gonna be able to take way too much legislation, most of it will be inexpedient to legislate, and figure out where to focus your attention. Without going blind and having a whole bunch of highlights.
As a rule of thumb, if
Still
any-
hallucinates and it can't spell. Doesn't take kindly to correcting it, to correct the spell.
as
Right,
a rule of-
I detest going over on a 2-hour meeting. I think I'd like to let everybody go on their separate ways, but we will be in touch. Get in touch with me about your work groups that you're interested in, and have a fantastic holiday season, everybody.
Happy holidays, everybody.
As a rule
Thank you all.